hour and a half presentation by Dr. Dennis Courtney. Well, there's a lot of questions in the audience. There's a lot of things we can still talk about. So we're going to run right into our roundtable discussion, and it's basically just a one-on-one with myself and Doc. So we've already had a few questions, and Doc's going to address them now with his recommended protocols. And you talked a lot about thyroid health, so let's dive right into thyroid health. But before we do, I got to tell everybody, years and years ago, not that long because she's not that old. My daughter, my oldest daughter, well, she's 38. So anyhow, I won't say her name so she doesn't get mad at me, but she went to doc because she was having some, endocrine thyroid related issues. And I learned for the very first time that day why women have more thyroid issues than men. And that's the first time that I ever learned that the highest concentration of iodine in your body is your thyroid, but the second highest concentration of iodine in your body is breast tissue. And if you have ample breast tissue, it may be robbing the iodine from your thyroid. And something as simple as that. But that's and then the iodine therapy that we've been talking about forever came from Dr. Courtney, and that had to be 15 years ago.
Yeah, and by the way, Joe, way you said it may. I'm telling you, it is. You don't get to escape. If you're Western Pennsylvania female, born and raised, you can't escape this. So the list of the symptoms that I handed out, you're going to find the symptoms. There's more than one that applies to you. And all you need is 4 or higher. And I got some women that come into my office and they check all the boxes. And I'm not surprised when it happens. So yeah, you were born in the goiter belt. The geological phenomenon here was that we have no iodine in our soils. Meaning, as children, we have barely enough to get by to supply the number one organ, which is your thyroid, with iodine. As we move through our childhood, we're all covered and we get through it in a healthy way. However, in our females, once puberty begins and breast development ensues, the demand for iodine now competes with the number one organ, which is thyroid, with the number two organ, which is the female breast. And neither of them get the amount that they require in order to operate correctly. As a result, therefore, we are the highest area of the country for breast disorders, dysfunction. We are it. Well, you surprised? Are you surprised? The breast hasn't been able to work since you were a teeny bopper, ladies. The breast is starved of iodine even today. So the breast didn't do itself away. The breasts remain. It was the thyroid that did itself away because you can't supply both organs from puberty onward. Therefore, it's our ladies that show these symptoms. As I said, since they were teenagers, it's you ladies. It's in August. The sweat's pouring off my nose. It turns evening. You look, every woman outdoors has a sweater over their shoulder. The men don't. It's always you ladies. You immediately get that chill. We're looking at you going, hey, you got to run to the car. We forgot this, because you're not going to be out there, ladies, without that, okay? So that's how you've sort of coped with it. I'm here to tell you, you don't have to cope. I'm here to tell you, I don't care how old you are. This is reversible. Now, I have some women that aren't too happy because I'm meeting them in their 60s. And I diagnose them as the hypothyroid person that they are, and I let them know, hey, you're going to get that all back. All of a sudden, they get angry. They get you could see they're upset. And I go, ma'am, what seems to be the problem? She goes, when I was in my 20s, I went to that young whippersnapper and I told him that I was having this and this and this and this. And he said, you know what? That's probably your thyroid.
Yeah. And it's normal.
And then he went and said, so let's order some labs to prove it. Unfortunately, your labs came back normal. And you could never raise the issue again. It's done. You're never going to have a discussion with that doctor again. He won't allow you to have the discussion because he already has proof that you don't have thyroid disease. That's why she's angry. She lost her entire life, all of her productive years, because of what that whippersnapper quickly determined didn't exist.
And that was doing one of the things that we always accuse the allopathic industry of doing, and that's treating the lab and not the person.
That's right.
Right?
That's right. So we have to treat you. You're my lab. I don't trust the labs. I have to order the labs because medical legally I have to have them in the chart. They come in. I do this. I just, who cares? Because I'm looking at your symptoms. I have 20 symptoms. You have 18 symptoms checked off. What? My lying eyes are going to be wrong here? No. No, you've got thyroid disease. It's just your labs are indicating it.
And back then, the only supplement around was iodoral.
It was iodoral, and it was good. There was a Lugol solution that were drops, but
and now we have iodine plus, and it's 12.5 milligrams per capsule.
Everything's 12.5. Isn't that
12.5.
interesting?
Yep.
Yeah. When you use the dropper, it was 12.5 milligrams per drop.
Uh-huh.
The tablets are 12.5 milligram per tablet. This is the way they come. A 12.5 issue has been carried through. So, ladies, what you need to do is you have daughters. And your daughters are as vulnerable as you are. And you need to start iodine like as a child. But certainly at puberty, you better bring it on because this is repeatable and never ends. Because we live in the goiter belt. If you're in Japan and somebody says to you, hey, by the way, where are you from? You say, well, I'm from Pittsburgh. They're not thinking Steelers. They're not thinking the Steelers. But if you say, well, I'm from the goiter belt, they'll put a pin right through your house on the map. Because the science world knows where the goiter belt is. You're actually famous and you didn't know it. Maybe for the wrong thing that's led to some pretty amazing symptoms that you've had to suffer under.
So now we had a gentleman with a question, and one of the signs of the hypothyroidism is cold, like you said, feeling cold in hands. But for men, it's different.
Yeah, I say that's why I handed 2 sheets out. There were the symptoms that women have and symptoms that men have. And the men, I never ask about cold hands, cold feet. But when a mid-age and beyond man tells me, hey, shake my hand, and you throw me a cold fish, that's a different cold fish than you ladies threw me, because that confirms that he has arteries so occluded with plaque that his primary objective needs to be dissolve the plaque, because these arteries are one thing, those arteries there are another, as well as the carotid. Serious issues develop with that. And we need to dissolve that plaque. So we start out with a Doppler of the carotid. Let's say it's 63% occluded. Well, we do chelation at about 18 treatments. We reordered them. We want to see how much we dissolved. The most famous patient I had, so I remember her too well to forget her. She came to me and said, Doc, you got to help me. I go, what's going on? Well, she said, I just came from my doctor's office. He says, I have to have a surgery immediately. I said, what do you mean? He goes, well, no. He said, I have completely occluded carotid arteries. And my doctors tell me that I have to have the surgery. I go, well, how bad is the occlusion? What percentage do you have? She said 90% and above. So I said to her, your doctors are right. You need that surgery. You can't delay. You got to get it done. She said, I can't. I just can't have the surgery. Doc, you got to help me. So this was my earlier years when I guess I was learning too. So I'm thinking, okay, all right, here's what I'm going to do. I'm going to make a deal with you. Here's the deal. You're going to be chelated 3 days a week for the next 6 weeks. Don't you miss a treatment. After those 18 treatments, I'm going to send you to repeat the Doppler. And if you don't have a substantial improvement in your plaque deposition, you have to promise me you'll get the surgery. So she promised, she came, 6 weeks went by, we ordered new Dopplers. This time, what was 90% and greater was now 47%. It happened in 6 weeks, and I always remember her because she taught me so much. I didn't know how powerful a tool I really had until she presented. So carry that message with you. I certainly carry it with me.
So let's take it down a couple steps. What if it's not 90, not 60? What if there's just some plaque? What can we do nutritionally? Things like nattokinase, serrapeptase, things like that.
Okay, well, nattokinase as well as kinase are the two kinases I would use for breaking up clots. Okay. Now, it is true that atherosclerotic plaque is plagued with bleeds all around them. Okay. So, to the extent that nattokinase and kinase could be helpful in these people, it doesn't dissolve plaque. Okay. There's only one thing that dissolves plaque, and that is EDTA. For the longest time, it could only be administered IV. There are a couple of companies that do make liposomal EDTA, which at least is able to get some of this stuff across the abdominal mucosa. But when you're talking about a lot of occlusion, I'm not going to recommend that you do this orally. You really do need to do it IV.
Okay.
Fair enough, Joe?
Fair enough. Okay. Yes. Okay. Adverse effects. Right. There's no such thing as a side effect. Right. It's direct effect. Okay.
Okay. So one thing, when you administer anything IV, not just EDTA, but it's metabolized in the kidneys. And so what we know is, based on the health of your kidneys, I can then only determine what dose you're allowed to have. So I have to get a creatinine level on you. So with your sex, your height, your weight, and your creatinine level, your age, there's a formula that allows me to know what the safest dose is for you. With that dose, I expect no side effects other than you're going to be losing minerals while I'm removing metals. And in the bag of what you're receiving, I'm loaded up with minerals to replace that which I know I'm going to lose. And so as long as this is done according to protocol, and nobody should be doing EDTA unless they have been trained. But if you've been trained, you know how to be certain that you're meeting all the requirements. I've been doing this now for, 20 years. There's never been any issue ever developed as long as we follow those guidelines. Fair enough?
Okay. Good. Okay. Any other topics or questions from the audience? Yes. What is the cost of chelation therapy?
To be honest with you, I swear to God, I don't know. My office manager knows. I get asked this all the time, and I purposely don't want to know. So just call the office. I think it's very reasonable. Okay.
See, he learned that from my countrymen or the Italians. The guy at the top never knows how much it costs, right, Doc?
Now,
No, you don't deal with
The
that.
people-
Yeah, somebody else will handle
somebody
that.
else deals with that.
Question. Enlarged prostate's the question.
Okay. So
Can I give my protocol?
I hope I know what you got in your stuff. Go for it.
Okay, I can't take credit for this, but I'll let Doc answer the question. But I will tell you this: I was at a conference 20 years ago. Dr. Andrew Weil, you know who he is? This guy's a guru of holistic health, Andrew Weil, and he was speaking in front of 200 doctors. And he said that he opened it up for questions at the end. And one doctor asked him, "What is your healthy prostate protocol?" And he said, "Oh, it's very simple. Have sex every day." He said, "Every day."
All right, Joe.
He didn't specify with who or what. He just said, "Have it," because the more you use it, the healthier it is. And that was his protocol. So where do you want to go from there?
I want to add on to that,
Go
Joe.
right ahead.
I think the gentleman might like. That's great advice, and hope you pursue it.
All right, so let's go beyond that.
All
Go
right.
ahead.
So there's a couple of things. As Joe would well know, in the alternative world, there are 3 substances that we know actually can shrink the size of the prostate. Of course, they are saw palmetto, Pygeum africans, and stinging nettles.
Yep.
Joe has products in here that meets all those requirements. And so if you're looking to use supplements only, these are the 3 that universally are understood by us all. On the other hand, as a medical doctor, what you are telling me, how many years young are you, sir? 59. So over the age of 50, many of us men deal with an enlargement of the prostate due to a condition referred to as BPH. That stands for benign prostatic hypertrophy. As long as the PSA has ruled out malignancy first, which I hope your doctor has checked and that you have no sign of. But anyway, what it does point out that your doctor isn't telling you is that you have the genetic proclivity when you metabolize your own testosterone to produce an estrogen precursor known as DHT. That stands for dihydrotestosterone. And if you have an elevation in DHT, and I believe you do, then by taking a blocker for the DHT, which is known as finasteride, your doctor certainly knows what it is. And remember, I treat with testosterone a lot. And I'm very concerned about the testosterone leading to a premature increase in size of the prostate. So every single patient I treat with the hormone, I am certain to block DHT. And so the add-on to the supplement, if that doesn't bring you the correction that you'd like to have, then would be to use finasteride prescribed by your doctor in order to shrink it. That's my answer. That is the drug of choice. It's risk versus benefit. There's always side effects of every drug. Why I hate to use them. But it's a risk versus benefit profile. So let me ask you the critical question. How many times a night do you have to get up to go to the bathroom? How many? Okay. So the size of your prostate is enormous. Risk versus benefit here says, hey, you need to have that gland shrunk. And although there are side effects, I'll say minimal, but the side effect is minimal only if it doesn't affect you. But there is an approach to use managed by your doctor that will help in alleviating that. Supplements are what go first. Okay?
Right. No.
The PSA, would you ask me?
Will sex raise PSA level, sexual activity? No.
Has nothing to do with
No.
malignancy at all.
No.
No.
No. It won't raise PSA level. It just it's a matter, you've heard the old phrase, use it or lose it, right? Okay. Well, it applies here too.
Joe keeps making that point. Very good, Joe. Any other questions?
Questions? Yes.
So, yes.
The question is just in general about stroke. Okay. Okay. So you're post stroke, right? Okay.
Okay. So, evidently, you're talking about how do I regain something that I may have lost. So, just quickly, a litany of things that should be on your treatment plate. We don't let just go the plaque that led to the occlusion that started this, because there's two kinds of stroke. The rarer kind of stroke is caused by a bleed, hemorrhagic. Was that your kind? No. The more common type is occlusive. And what do you think the occlusive is? It is plaque that has the bleeding going on around it, and that you throw a clot from the very plaque that exists in close proximity to your brain. And arteries always go from larger to smaller. And at some point, depending on the size of the clot, it's going to stop immediately the flow of blood to a region. Whatever region that the brain and function that is controlled by it, you lose. If you're lucky, you have what's called a TIA. It was a transient ischemic attack, and the whole thing goes away in 24 hours. You weren't that lucky. You actually had a full-blown stroke, which requires the rehabilitation afterwards, but it all seems to be physical therapy related, which I can appreciate, but we got to deal with the cause, because you're just as vulnerable to another stroke as you would have been before the first one. And so Beluca lumbrokinase, nattokinase. We need platelet aggregation inhibitors. We need to put slime on platelets, okay? And one of the ways is to use the oils, okay? As well as the medicines in the world of allopathy, this substance called Plavix. Aspirin also puts a layer of slime on platelets. These platelets then slide over one another and don't stick. So that's a great therapy in conjunction with the occlusion issue. Okay? Answer your question? Any others?
Good. Yes.
So, if the doctors say you have borderline blood sugar and you have cholesterol borderline, what's your suggestion?
Okay, so you're confronting the number one disease of our generation. This disease is called metabolic syndrome. You are the walking and talking embodiment. And by the way, don't feel lonely out there. About 80 to 90% of the population is walking in your shoes. This is the disease of our generation. Our diabetes rates have gone through the roof, and it's rumored that by the time the next generation comes around, it'll be the first generation in which we've lost the number of years to survival.
Mm-hmm.
It's going to go backwards because this metabolic syndrome is going through the roof. So there's actually a very good treatment for metabolic syndrome. I manage people with that treatment. I head you to the website called flccc.net, in which the entire protocol is listed. Hope to see you soon. We will talk about what to do. All right?
So
What's the website again?
flccc.net. .net.
It is 3 C's.
so it is
It is 3 C's. Yes. I'm sorry.
Now,
Now-
Frontline COVID Critical Care Alliance, FLCCC.
Now, metabolic syndrome, just so everybody knows, is usually it's comprised of 4 components. And it used to be called Syndrome X, because if you make an X, you got 4 points, right? So metabolic syndrome is elevated blood pressure, elevated cholesterol, or insulin resistance, pre-diabetes insulin resistance, and obesity, okay, or weight gain. Those are the 4 components to metabolic syndrome. And they're all related. Of course, they're all related, and they're all, yeah. Mm-hmm. Okay, that's a good start. Absolutely, because this, as Doc said, it's the disease of our generation, but it's lifestyle caused and lifestyle cured. Okay, it's not a death sentence because it is based on lifestyle, and it involves everything: food, movement, all the foundations to health. Okay, but the key is, in my opinion, Doc, the key is insulin resistance. What do you think?
Well, that is the
Yeah.
provocateur.
Yes.
It's not that you don't make enough insulin, you got an overabundance of it. But the cell membrane can't process it to allow glucose into the cell.
Mhm.
So therefore, you have exhausted. You have so much insulin you put out because of your diet and the inappropriate use of carbohydrate intake that you're just loaded with insulin. And now the membrane can't respond because it's just say, the hell with you. No, we can't do it anymore. Okay. And so we got to win that back through a diet as well as supplements. And that protocol is at that website. Oh, we want you to be on, you can't ignore that. Okay. Yeah. Your diet is going to have to be reframed.
Yes.
You don't get to say, oh, well, I'm doing these supplements, so it doesn't matter. Oh, no, it matters.
It matters. Yeah, you have to eliminate refined sugars and most refined carbohydrates. Yes, absolutely. But it's also, it's lifestyle, right? It's everything. It's not just one thing. That's why this is called a syndrome, metabolic syndrome, because they can't actually prescribe one drug for it, because there isn't. Okay, so in that respect, it's not really a disease; it's a syndrome. And so we're equipped to help you handle that.
You really are.
Yeah, we are. Well, folks, I think we're running out of time. One more question.
Like East diet, like East, don't eat all the East. What's that diet?
That's another diet high in carbohydrates. The carbohydrate composition of a person's diet leads to so many medical issues, and fungal infections are absolutely hand in hand with that.
The rise in candida,
Yeah.
all of these things are all related to that. Absolutely. Sure. Body can't process it. And there's deficiencies involved. Like Doc said, that cell membrane can't get the insulin can't get the glucose into the cell. Okay, because of our diet, because of our lifestyle, and because of deficiencies. There's several trace minerals that are at the heart of this. Chromium and vanadium are at the heart of that membrane, allowing it to open to let the insulin get the sugar, the glucose in to the mitochondria. So we have deficiencies, we have toxicities, and add them together, and you get a syndrome.
Which leads to all the diseases of our generation.
That's correct.
So it just doesn't end by somebody saying you're pre-diabetic. This is not something you want to be pre of, okay? You want to run the hills, because the baggage that you bring along with that word pre, you don't want to confront. It will definitely be the issues of your mortality, because they are the issues of our mortality. And you, at this age, have the ability to intervene. I expect you to do so.
We're gonna have to wrap it up now. If you want, if you can. Oh, he'll be back.
We would.
He'll be back. Yes, absolutely. He'll be back. So I want to thank Dr. Courtney, and I want Dr. Courtney to give everybody, make sure you all have, and do it on air, your contact information, Doc, for everybody, so they
okay.
can get a hold of you, make
So
an
once again,
appointment.
my office is in 5168 Campbell's Run Road. That's on the way to the airport. It's at the Ridge Road exit. Instead of going up on top where all the stores are, you stay down on below, go by the 2 hotels, and the first opening after the second turnoff to go up the hill. That's my driveway into my office building. I'm in the back. Now, with respect to the eyes,
Phone number.
and the phone number is 724-942-3002. You should head to my website, because if you have an eye issue that is of that type, there are a number of videos. There's an entire section on my website that I would much rather you review first, and then it'll tell you, call me. We don't have to wait till I'm here next time.
Was diagnosed 30 years ago.
Okay, and the diagnosis was?
Photobia's which a couple years ago they changed to macular.
Okay, so that's a retinal disease. There is no treatment for you with a retinal disease.
Well, they said there was no hope I was going to go blind back then, okay? But they did come up with something.
Well,
It was a shot.
they
And I'm stabilized.
the shot is to remove the blood loss.
Right.
You bleed.
But I haven't had
Okay, so
stabilized.
I'm glad this came up.
Yeah.
There are some procedures that conventional medicine can use. It doesn't change the disease. But if you have a bleed in your retina, you'll find a retinal specialist that on a monthly basis will go through the eye. It's a syringe now, goes through the eye and deposits
Everybody's cringing in the audience.
Avastin, which is the name of the drug, to stop the bleed.
I've been stabilized for 10 years.
Okay. But your retina is damaged and he cannot get that back. I can. That's the message. Any lost vision, we can restore it. This sounds like a fable out of, The Wizard of Oz, but it truly is possible, thanks to Condrat, who came up with this after what I taught him works so doggone well. I didn't even know how powerful the treatments were, but I certainly know now, and I do these every month, these programs. Okay?
Okay. Let's hear it for Dr. Dennis Courtney, everybody. Thank you.
Thank you very much. It was a pleasure to be here, Joe. Thank you. Okay.